What's up, beautiful people? Recording this video while getting in my steps, but you know the drill. Another study, another day. So, we've talked about cognitive resilience on the channel before, and that is the theory that, well, not theory, we actually see this over and over again. And it's when you have pathology related to dementia or mild cognitive impairment, and that could be either on autopsy, it can be brain scans, it could even be blood biomarkers, and the level of cognitive impairment, or if cognitive impairment is even there at all, is not seen when there's a lot of pathology. And we see this all the time in other things. For example, with back pain, you can have a MRI that looks absolutely terrible and no back pain, and severe back pain and completely normal imaging. So that's the essence of cognitive resilience. It's what can we do that, despite having pathology for dementia, that it actually improves our cognitive function or makes us more resilient to developing dementia. So we know that cognitive enrichment has been associated with both cognitive reserve, so more cognitive function as we get older, and also with resilience, meaning less decline in the presence of pathology associated with dementia. Late life cognitive enrichment has been associated with lower dementia incidence, better cognitive function, slower rate of cognitive decline. But this study was looking at actually lifetime cognitive enrichment. And so they looked at three things with that. They looked at lifetime cognitive enrichment in Alzheimer's dementia. They looked at cognitive decline. They looked at dementia-related pathology. And cognitive status was assessed by experienced clinician visits and cognitive testing, clinical judgment, and diagnostic criteria. And then about 2,000 patients were followed for an average of just over 7.5 years. And they created a composite score for early, mid, and later life cognitive enrichment. And by cognitive enrichment, they included things like socioeconomic status, playing games, learning a new language, availability of books and other resources like that. And so every 1 point increase in their cognitive enrichment score was associated with a 38% reduction in dementia risk, and higher scores were also associated with later onset of dementia. So individuals in the 90th percentile for the cognitive enrichment score versus the 10th percentile developed dementia 5.4 years later. And when they looked at mild cognitive impairment, which can be a precursor to dementia, some people with it don't go on to develop dementia, but they still have cognitive impairment. The risk was reduced by 36% for every 1% increase in cognitive enrichment scores. And in those, again, in the 90th percentile, developed mild cognitive impairment about 7 years later compared to those in the 10th percentile. And then also, higher lifetime cognitive enrichment was associated with better baseline cognition and slower rate of cognitive decline relative to the 50th percentile, so being in the middle. Those in the 10th percentile declined 14% faster, while those in the 90th percentile declined 10% slower. And then higher cognitive enrichment was also associated with higher global cognition and slower rate of decline, independent of neuropathology. So when they assessed what was going on in the brain on autopsy. So that's that cognitive resilience that I talked about earlier. So this aligns with the body of literature showing that you can't ever stop learning. You always have to keep your brain engaged socially. You have to keep your brain engaged with tasks that you find enjoyable or pleasurable. And you have to be learning new skills. You're never too old to learn new skills, to enrich your knowledge, to grow. And that's my philosophy. I don't ever plan to stop learning, stop growing, stop trying new things, developing new skills, because one, it makes life far more enjoyable. And two, I know it's good for my brain.